Welcome, everyone. Today, we're exploring a medication known as Orphenadrine, commonly sold under the brand name Norflex. As always, this discussion is intended for educational purposes. Should you have any health-related questions or concerns, it's crucial to consult a medical professional. Description: Orphenadrine, marketed under the brand name Norflex, is an oral tablet and injectable medication classified as a muscle relaxant. Its primary purpose is to relieve muscle pain and stiffness as part of a comprehensive treatment plan that includes rest, physical therapy, and other measures. Norflex works by blocking nerve impulses, or pain sensations, that are sent to your brain, thereby helping to reduce muscle spasms. Although not a cure for underlying conditions, it aids in improving mobility and comfort during the healing process. Norflex is often prescribed for short-term use to treat muscle spasms associated with acute musculoskeletal conditions. Warnings: Norflex should be used with caution. It's not recommended for individuals with a history of glaucoma, urinary or gastrointestinal blockage, myasthenia gravis, or those who have had a hypersensitivity reaction to orphenadrine or similar medications. Additionally, due to its anticholinergic effects, caution is advised for those with a history of heart disease, arrhythmias, or congestive heart failure. Before taking this medicine. Before starting Norflex, it's important to discuss your complete medical history with your healthcare provider, especially if you have ever had liver or kidney disease, asthma, hyperthyroidism, prostate enlargement, or a history of drug or alcohol addiction. If you're pregnant, planning to become pregnant, or breastfeeding, consult with your healthcare provider to weigh the potential risks and benefits. Orphenadrine may cause dizziness or blurred vision, so it's advised not to drive or operate heavy machinery until you know how the medication affects you. Side effects: Common side effects of Norflex include dizziness, drowsiness, lightheadedness, blurred vision, dry mouth, nausea, and vomiting. These effects are usually mild and temporary, but if they persist or worsen, contact your healthcare provider. Rare but serious side effects include confusion, anxiety, tremors, fast or irregular heartbeat, and difficulty urinating. If you experience any of these, seek medical attention immediately. Interactions: Orphenadrine can interact with other medications, potentially affecting how they work or increasing the risk of side effects. This includes, but is not limited to, antihistamines, anticholinergics, certain antidepressants, and alcohol. Inform your doctor about all the medications, supplements, and herbal products you are taking to manage interactions effectively. Dosage: The correct dosage of Norflex is crucial for its effectiveness. Typically, the oral dose for adults is 100 mg taken twice daily, with the specific dosing schedule depending on your condition and response to treatment. For injectable forms, your healthcare provider will administer the appropriate dose. Always follow your healthcare provider's instructions and do not adjust your dose without consulting them first. Avoid: While taking Norflex, it's advisable to avoid alcohol and other central nervous system depressants, as they can enhance the sedative effects of the medication. Also, stay hydrated and avoid overheating, as orphenadrine can decrease sweating, increasing the risk of heat stroke in hot environments. FAQ: Many people ask about the duration of treatment with Norflex. It's typically prescribed for short-term use, usually 2 to 3 weeks, as there's limited evidence of its effectiveness for long-term use. Always discuss the duration of your treatment with your healthcare provider. Closing: That concludes our discussion on Orphenadrine, known by the brand name Norflex. This guide is designed to educate and should not be used as a substitute for professional medical advice. For any concerns or questions about this medication, please consult with a healthcare provider. Thank you for joining us.